Now we're going to talk about lateral joint congruency for lateral meniscus tears specifically. Or if you just feel like the lateral compartment of the knee needs a little more congruency. All right, so position-wise, we have the knee of interest up on this one. We have the lower leg bent. We have the top leg straightened. And either a 6-inch foam roll or 2 half foam rolls to support the leg, okay? So now from here, I am interested, I need to lower my table because I need to be able to get over the top of the knee with my manual contact, right there, all right? And so we start with the knee a little bit bent, all right? And if someone has a medial meniscus tear and you're going to do a lateral congruency, you've got to be really careful because you're kind of shearing the knee down towards the table. So it can be kind of a scary technique for those people. But most of the time you're doing this with a lateral meniscus tear. Okay, so I'm not going to put a lot of pressure on Kelsey here. So I have her knee a little bit bent. I would press straight down, shear down towards the table, compress the lateral portion of the knee, and then I would have her straighten her knee out, and I would just want to see, is there any bit of a speed hump or speed bump whenever she's straightening her knee out, meaning all of it just wants to rise up into my hands. I took my hands off because with her, as she was straightening, everything was just like excessively almost shearing down towards the table, which I don't want in this. Okay, so that would be a negative test for her. But then if I were to go to treat this, I would compress, or I would shear down towards the table, compress, and then I would have her come back until I felt that speed hump. I would have her hold there. And I actually put a little bit of P to A pressure with this, and then I'll let her bend it a little bit, and then I'll have her straighten it, and then bend it a little bit. And this would be kind of a combination of isotonics through range to where ultimately we want to get her to where she can go all the way straight without that speed hump coming up. And then I would just hold there, Kelsey, don't let me push you there. And then I would just kind of try to stabilize it in that final bit of range. Then we can go back, reassess, make sure that speed bump has gone away, and that is lateral congruency technique for the knee.